Welcome to the Deep Dive. Today we're tackling a topic that touches the lives of so many. The challenging, but also, well, exciting prospect of changing careers.
Yeah, it's a big one.
And specifically, we're zeroing in on nurses. We're looking at how their incredible skills honed in, let's face it, one of the most demanding environments imaginable.
Absolutely.
How those skills can be leveraged in entirely new roles, maybe staying within healthcare, maybe branching out completely.
Right. And we've got some fascinating sources here. Articles looking at why they change, what options are out there.
And a really candid online discussion among nurses themselves, too. Frustrations, hopes.
That was revealing. Plus some detailed reports on specific alternatives like clinical research associate, clinical informatics.
Okay, so let's unpack this. Our mission for this deep dive is really to pull out the essential insights from all this material you've provided.
Exactly.
We want to understand why this shift is on the minds of so many nurses, pinpoint those really powerful transferable skills they have.
And they are powerful.
And then explore some specific, concrete career options that come up in these sources. Think of this as a guide built right from this info to help light up potential path forward for you listening.
And these sources, they give us a remarkably clear picture, both the pressures pushing nurses towards change and the undeniable value they bring to any new role.
So where do we even begin with the why? The sources are pretty emphatic about this.
They are.
Nursing is intensely demanding, and that pressure cooker environment, it often leads straight to burnout.
That word comes up again and again.
Yeah, we saw one article, the really striking statistic, 66% of nurses surveyed pointed to burnout as a leading cause of the national nurse shortage.
Wow. So it's not just personal, it's systemic.
Exactly. It's impacting the whole system.
And it's easy to see why when you look at what the sources detail. The stress levels are just immense, often made worse by insufficient staffing. Imagine this. One survey mentioned only 33% felt they had adequate staff.
Only a third. Yeah.
That directly hits workload, patient safety, everything. Then there's the constant search for better work-life balance.
Right, which is tough with those common 12-hour shifts.
Nights, weekends. It makes regular life hard.
Absolutely. And it's not just mental or emotional, is it? The physical side is significant too.
Oh, definitely. One source painted a vivid picture. Walking up to 5 miles in a single 12-hour shift.
5 miles? Wow.
All while doing physically taxing tasks and carrying, the profound emotional weight of seeing suffering, loss, day in, day out.
That emotional load.
It's huge. But beyond the strain, sometimes it's also just a natural desire for growth, for new challenges.
Zero, like in any career.
Exactly. That online discussion thread was really telling here. We saw comments from nurses feeling stuck or like a robot. Yeah.
Because of the pace, the checklists.
Right, that relentless pace, the feeling of just ticking boxes, that sense of emotional drain. Even if you fundamentally love caring for people, it's a powerful reason to look elsewhere.
Okay, so that's the push. But here's where it gets, I think, really interesting.
The skills.
Yes. Despite maybe feeling drained or like just a nurse, as some online comments sort of hinted at.
Which is so far from the truth.
Right. The sources universally agree. Nurses possess an incredibly rich toolkit of transferable skills. Skills that are absolutely golden in other fields.
Totally agree. It might not always feel obvious when you're, knee-deep in a busy shift, but the sources really hammer this home.
They do. And it's more than just good under pressure, isn't it?
Oh, much more. What comes through is that nurses aren't just clinicians. They're masters of high-stakes human interaction, complex problem-solving, meticulous process management.
Yeah, think about it. Managing multiple complex patients, anticipating crises, communicating difficult news, clearly under stress.
All while staying calm, showing empathy, and sticking to rigid protocols. It's a unique blend.
Exactly. We're talking top-tier communication abilities. Educating, collaborating with diverse teams, building trust fast.
Deep problem solving. Critical thinking to manage volatile situations, adapting constantly.
And that attention to detail, it's almost innate. Accuracy isn't just nice to have, it's critical. In documentation, in procedures.
Non-negotiable, plus time management and organization that, frankly, most people can only dream of.
Right. Prioritizing, juggling urgent demands, hitting deadlines under massive pressure.
And the sources highlight exceptional empathy and emotional intelligence, too. Really understanding and responding to needs, navigating complex personal dynamics, even hospital politics sometimes.
Add to that, networking, relationship building, genuine teamwork where decisions are shared,
Efficiency, thoroughness, customer service skills with patients and families.
and significant abilities in teaching and mentoring others. It's a huge list built in a real crucible.
And you see this disconnect sometimes, right? One online person mentioned that nurses have all these skills,
Yeah,
but maybe they don't know how to talk about them for, say, a corporate interview.
framing it differently.
Exactly. They even suggested maybe using AI tools like ChatGPT to help translate that nursing experience into language that, resonates outside healthcare.
That's such a practical point.
Yeah.
And another source really stressed the difference between hard skills, your degree, license, specific procedures.
The technical stuff.
Right. And the soft skills, communication, problem solving, empathy. They argued that for a career change, it's often those soft skills that matter most.
Definitely. They show how you'll fit, how you'll function in a new environment, a new team.
Your clinical knowledge is the foundation, sure. But your ability to operate effectively in that complex human system, that's your adaptability.
Well said.
Okay, so we got the powerful why and the incredible what, the skills. Now let's look at the where. Let's dive into some specific career options mentioned in these sources.
Right. How do those skills actually map onto new roles?
Exactly. We can kind of group these. Some keep you in the broader healthcare world, just not at the bedside. Others move outside healthcare altogether.
Okay, so staying within healthcare, but non-bedside. The sources bring up roles like nurse educator.
Training other nurses.
Yep, developing and running training programs, passing on that clinical knowledge. This usually needs more education, like a master's or doctorate, plus experience and certification.
And the pay?
One source mentioned an average in North Carolina over $100, so it clearly leverages those teaching and mentoring skills.
Makes sense. Then there's healthcare administrator, overseeing facility operations, budgets, staff, compliance.
The business side of healthcare, essentially. Usually needs a bachelor's, maybe in healthcare admin or business, plus experience. Strong leadership, finance, operational skills are key.
Certification probably help too.
Definitely. A source cited an NC average around 64K. This really taps into the organization, problem-solving, teamwork skills from nursing, but at a systems level.
Okay. Now, one role specifically highlighted for nurses was clinical research associate, CRA.
Yes, or clinical trial monitor. This is interesting. CRAs work with pharma or biotech companies or research organizations, CROs.
Really, what exactly?
Their main job is ensuring clinical trials are run safely for participants, that the data is accurate, and everything follows strict regulations like ICH, GCP.
ICH-GCP.
International Council for Harmonization Good Clinical Practice. It's basically the global standard for trial, quality, and ethics.
Got it. So less direct patient care, more oversight, process, data.
Precisely. It often involves a lot of travel to monitor trial sites, verifying data against source documents. That's called source data verification, SDV.
Okay.
Managing huge amounts of documents in the trial master file, the TMF, training site staff, getting sites ready for audits.
Sounds detail-oriented.
Hugely. The sources lay out a whole competency framework. It demands incredible attention to detail, very precise communication, written reports, verbal updates, reading complex protocols, numeracy for data checks, plus those core nursing skills. Problem solving, teamwork, organization. Your clinical background is a massive advantage for understanding patient safety and how sites work.
Fascinating. Another path mentioned was clinical informatics professional.
The tech side. Yeah, these folks bridge clinical practice and technology, using data and IT to improve care quality, efficiency, safety.
How do they do that?
They take their understanding of clinical workflows, how things actually happen on the floor, and apply it to optimizing things like electronic health records, EHRs.
Making the tech work better for the clinicians.
Exactly. Helping hospitals use data better for decisions, improve care coordination, ensure tech meets regulations. They're seen as vital for innovation, saving clinicians time, improving the patient experience, maybe through real-time updates, and even boosting revenue by improving outcomes.
And nurses are moving into senior roles here.
Definitely. Roles like Chief Nursing Informatics Officer, CNIO. Staying current is crucial, though, with things like predictive analytics or integrating data on social determinants of health into EHRs.
So it takes that problem-solving, detail focus, critical thinking from nursing.
And applies it through a tech and systems lens, high-level stuff.
Then there's nursing consultant, working with hospitals.
Often, yeah, maybe for external firms. Helping facilities support and retain their own nurses, improve the culture, develop leaders, enhance clinical processes right there on the units.
Often former nurses themselves.
Very often, according to the sources. It leverages their leadership, communication, empathy, and that deep lived understanding of the nursing environment.
Makes sense. The online discussion also mentioned IT tech support, maybe civil service jobs,
Yeah.
areas where those skills transfer.
Right. Broader applications.
Okay, what about moving outside healthcare completely?
The sources had options there too, like medical writer.
Creating scientific content.
Yeah, clear, accurate medical and scientific content for different audiences.
Yeah.
Regulatory bodies, patient leaflets, educational materials, need strong writing and research skills, sometimes certification.
Salary potential.
One source gave an NC average over 104K. Definitely uses those nuanced communication and education skills.
Pharmaceutical sales rep also came up.
Right. Promoting and selling medications to healthcare professionals, building relationships, providing accurate product info, staying constantly updated on the science.
Background needed.
Usually a bachelor's, often science or business. Strong communication, sales skills help. Certification can be a plus. NC average cited was around 89K, leverages communication, networking, and comfort with medical info.
Okay, and a perhaps surprising one. Real estate broker or agent?
Yeah, this one stood out. The sources highlighted it specifically for nurses.
Why? Seems like a big leap.
Well, the potential for flexibility, better work-life balance was mentioned, plus playing a meaningful role in a major life decision for clients. Salary potential was high too, one NC average for agents over 109K.
But the skills, how do they transfer there?
The sources make a pretty compelling case, linking it right back to core nursing skills. Think about it. Communication, educating clients through a complex process.
Okay.
Problem solving, navigating market issues or deal problems, attention to detail contracts, paperwork.
Right, crucial there.
Time management, juggling clients' showings. Empathy, understanding the stress of buying or selling a home. Networking, building your client base.
Okay, I can see the parallels now.
And it's noted you can often start part-time while still nursing. Kind of test the waters, build contacts.
That's practical. The online chat also mentioned HR admin roles.
Right. Focus on people, difficult conversations, maybe occupational health aspects. One person there mentioned an initial pay cut, but higher earnings later.
And a note that transferring a nursing degree directly into, say, a UK teaching qualification, a PGCE, seemed difficult.
Yeah, specific qualification pathways matter.
So regardless of the path, whether it's CRA or real estate or something else, the sources give guidance on how to make the switch, right? The steps involved.
Yes, clear steps. First, crucially, self-assessment. Really take stock of your skills and interests.
Be honest, yeah. Hard skills, soft skills.
Exactly. What do you know technically, and what are those powerful soft skills? Use career quizzes, skills inventories, really reflect on how nursing built those transferable abilities.
Okay, step 1, know thyself. Step 2.
Research. Explore industries, specific roles that align with your assessment. Dig into the job requirements, what the day-to-day looks like, salary, growth potential.
Look at actual job postings.
Absolutely critical. And one source suggested searching job boards using the specific skills you identified, not just job titles.
Smart. Then what?
Network. Connect with people already in those fields. Go to events. Join online groups. Find mentors who've made similar moves or are in your target role.
Networking can open doors you don't see online.
For sure. And finally, be ready to pursue extra education or certifications if needed.
Identify the gaps and fill them.
Right. Degrees, licenses, specific certs. We mentioned them for nurse educator, admin, CRA, medical writer, pharma sales, real estate. Even nurse health coaching needs RN plus certification.
And that practical challenge came up in the online discussion too, didn't it? Finding the time and energy to do all this while still working a demanding nursing job.
Yeah, that's a very real hurdle. Job searching itself is exhausting, let alone when you're already burnt out. It's important to acknowledge that.
Okay, so wrapping this up, what does it all mean? Our deep dive into these sources, it really paints a compelling picture, I think.
I agree.
The pressures driving nurses to consider change are significant, very real. Burnout, workload, work-life balance.
But the flip side is equally clear.
Exactly. The sources overwhelmingly show that the skills developed in nursing, the resilience, problem-solving, communication, empathy, are incredibly valuable and directly applicable across a huge range of careers.
Both inside specialized non-bedside healthcare roles and in totally different sectors.
Right? Roles like clinical research associate, clinical informatics, healthcare admin, medical writer, pharma sales, even real estate broker. These are just a few concrete examples where that nursing foundation gives you a powerful head start.
Sometimes you need extra qualifications, sure, but you're building on such a strong base of those transferable skills.
Making any big career change isn't easy, of course. It takes that careful self-reflection, research, proactive steps to bridge gaps.
It's a major undertaking.
But the potential is clearly there, grounded in that unique experience, those capabilities that nursing provides.
Definitely.
So maybe the most provocative thought to leave you with from this deep dive is this. Given the profound level of skill, resilience, and frankly, human understanding that nurses develop, what other totally unexpected fields, maybe ones we haven't even touched on, could benefit immensely from bringing that unique nursing perspective to the table?
That's a great question. Where else could that skill set make a difference?
Something to think about as you explore your own path forward.